Welcome to our channel Small World Aussie. My name is Megha. In today's video, I will be talking about the positives and negatives of working as an AIN. Let's start with the positives. Number one, plenty of opportunities for work. If you are a very hardworking AIN, you will not find yourself out of work. Number two, as a casual AIN, you can choose which ward you want to work in. Because I did my training in orthopedic ward, I preferred to work in orthopedics and rehabilitation ward. But similarly, you can choose to work in palliative, dementia, geriatric, children's, surgical, medical. There's so many options. Number three, less responsibilities than a registered nurse or an enrolled nurse. So, as an AIN, your scope is very limited, and you do not do you cannot do certain work such as putting an IDC in or putting an IV in or complex wound dressings. All that will not come under an AIN scope. So where I work in as an AIN, I can write progress notes, but I have also noticed that certain wards, certain hospitals do not allow the AINs to do progress notes. So it depends where you work. Number four, this is a great opportunity for you to get the feel of work, to understand shift work and how to work in the hospitals, to be rostered on different to work on different duties, like sometimes it's morning duty, sometimes it's afternoon, sometimes it's night. So this is an excellent way you can get the experience of working in a hospital. Number five is flexibility. So as an AIN, you can work full time, part time, or casually. And if you have kids like me, if you have a kid like me, then it's easier for you to juggle everything. And working as an AIN is also a great opportunity when you are a student because you can work casually. Now let's talk about the negatives. So number one negative is that because as an AIN there's less responsibilities than a registered nurse or an enrolled nurse, the pay is also less than what a registered nurse or what an enrolled nurse will get. So presently in a public hospital in NSW, an AIN will get a first year AIN will get $24 per hour. When compared to a registered nurse, they will get around $33 per hour. So you can understand when the responsibilities are less, the pay is also less per hour. Number two, there is no scope for growth as an AIN. So your responsibilities and scope will be the same in the first year, and it's going to be the same in your fifth year of work as well. But I have met a lot of people when I was working that they have been working as an AIN for the past 10 years and they enjoy doing that. So it depends on on each person what they want to do in their life. Number three is challenging patients. Sometimes certain shifts I have encountered very aggressive patients or patients which have very heavy needs. Number four is as an AIN, you're always working under a registered nurse. So some people will find that okay, but because I like to do certain things on my style and I have developed my own, ways of doing from my experience, I prefer to work alone. So that sometimes it's a little bit difficult to negotiate or to manage because the RN will have their own style of doing something, and I might have a different style, which will not, sometimes it will not go together very well. So there's a lot of diplomacy required in such situations. So these are some of the positives and negatives of working as an AIN. I'm sure most of you will have a lot more ideas and points in your mind. Do share your ideas in the comments below, and I'll see you next time in another video. Thank you. You can work wherever you